Incredible conversation. My name is Debbie Bergeron. I am the Deputy Director of Community Engagement and Innovation here at the National Head Start Association. And I am joined by Julie Collins, who's going to introduce herself in just a minute. And we are both so excited to be here to announce a new partnership between NHSA and Child Welfare Services to look at how Head Start and Early Head Start and welfare agencies across the country can collaborate for greater outcomes for their children and families, and to maximize benefits to staff and to programming. Back in, Julie helped me, I think it was January, now I can't remember, I think something like that. I went to Washington, D.C. CWLA had a big conference and we did a session together just to start talking about this idea. And I'm excited to announce to everybody that I think today our MOU was ratified. So our timing of our webinar here couldn't be better. So we have an official partnership that spells out exactly what we would like to be doing over the next 3 years. But today is really about bringing all of you together so that we can share ideas and really get this started with high energy and really thinking creatively about how we maximize our resources in communities and benefit from the shared value system that both of our organizations hold so dearly. So I am going to turn it over to Julie, and our agenda loosely for you today is CWLA has a presentation for you, and then we're going to do a little back and forth between you and us, and we want to hear your ideas, and we'll open it up for questions at the end. So please stay with us the whole time. Be ready to share. This is not just a delivery webinar. We're here to kind of share ideas, and we're very excited to hear about what's happening in your communities too. Julie, take it away.
Thanks, Deb. So welcome, everybody. It's wonderful to have you on. I am the Vice President of Practice Excellence at CWLA. It's my honor to really be with you and to really have this wonderful partnership. Both our organizations know how critical it is to collaborate in order to really deliver services, help families, and really work with them and help them be the best that they can be with their children. And so doing it at the national level is even wonderful, because we really want to make sure that we're supporting you all in your work in whatever way that is. And lots of good work happening, as Deb said, and you'll be hearing from two of our panelists who will illustrate that. And they are wonderful examples because they work in both systems, Head Start as well as in the child welfare system. And but we know many of you also do. So we want to really highlight those. We want to enhance them, maybe do replication of them. So as Deb said, we're just at the beginning and there's lots of possibilities. So we're really hoping to do this journey with all of you as we go through with this. So without further ado, I'm going to turn it over to Donna Pressma and Keith Liederman. Both of them are heads of organizations. They'll explain more in terms of their introduction. So here you go.
Great. Thanks so much, Julie. Hey, everybody. It's good to see so many people on this Zoom webinar and such great participation from around the country. So I'm Keith Liederman, and I'm the CEO of Clover in New Orleans, Louisiana, formerly known as Kingsley House. And I'm joined by my esteemed colleague, Donna Pressma, who's the president and CEO of the Children's Home Society of New Jersey. And both of our organizations are really steeped in both early learning through Head Start and Early Head Start primarily, and child welfare, with a number of very child welfare oriented programs that each of us respectively has run over the years. And so we've seen firsthand how these systems can really effectively work together. And so we're going to do a really quick walkthrough over the next 10 minutes or so of some of the major child welfare challenges that we all face throughout the country, and where we, Donna and I, see opportunities to bring Head Start and child welfare systems together. So I guess the first, if you can go to the next slide, the first question is, that I think when we were involved in establishing this historic partnership between NHSA and CWLA, we kept revisiting the question of, why collaborate not just on the national level, but why collaborate locally? Like, what do we lose? What do we gain? We realized, and what we've seen through our experiences, that we gain a whole lot, and it really enriches the services that are available to kids and families. It increases enrollment in really beneficial programs, and we'll talk some about the public assistance programs in particular, and Head Start oriented programs that really are intentionally coordinated across our systems, early learning and child welfare. And then, perhaps as importantly, or even more importantly, being able to join together across the systems to advocate for public policies that are going to positively impact our systems and those we serve, and also advocate against public policies that are going to adversely impact the people that we serve and our systems. What we always have realized in crossing between the two systems and bringing them together is that we are definitely better together. If you can go to the next slide. So just in terms of the major child welfare challenges that we face, first and foremost, we always think about child safety. And so, as those of you who are involved in early learning know, in Head Start and early Head Start in particular, we've got very professionally trained eyes, mandated reporters who, in our teaching staff and all of our support staff in our centers, that are focused 100% on children, 10 hours a day, 50 hours a week, year round. Our social service and support staff included, we are lock solid focused on the child. And we also prioritize enrollment for children that are experiencing homelessness, foster care, kinship care, and other special needs. And so right there, it clearly is a pretty poignant intersect with child welfare. So in terms of partnering, Head Start and early Head Start for child protective service workers in particular can be a really great source of real-time information on any cases and families with whom Child Protective Services is currently working. And CPS, on the flip side, can also provide really important information to us as Head Start and early Head Start providers on how the families are doing. And what are they encountering? What was the initial trauma that kids and families faced? What, if anything's come up since that time? What's going on? What are the ongoing risk issues and areas of concern? And then also for closed Child Protective Services cases, we can continue to provide those eyes on the child and the family, sometimes for years after a CPS case is closed out. And as mandated reporters, there's a guarantee there that if something happens that poses risk to the child, we're going to go back to Child Protective Services and reconnect that family as needed. And then, another potential is just helping with coordinating in neutral sites, supervised visitations, not necessarily at our Head Start and early Head Start centers, but since we have the child and the parents with us for as long as we do throughout the week, just trying to be part of the team that's navigating that and negotiating the supervised visitation with the families can be, a really great partnering opportunity between Child Protective Services, Child Welfare, and Head Start and Early Head Start. So next slide. So, you know, in terms of the another child welfare challenge, I'm going to turn it over to Donna to talk about food insecurity.
Okay, hello everyone. We've been doing this since 2005, jointly merging our services from within our agency and with strong partnerships in the community. I particularly asked to speak on food insecurity. I don't think there's a place in the nation that our Head Start families and early Head Start families aren't dealing with it. We have had a remarkable partnership with WIC, which you can have. The money is there in the community. You just have to encourage your WIC collaborators to just do what can be done. We have a WIC mobile van, and the WIC mobile van gives full WIC services, certainly the vouchers, which are so critical because it adds to a parent's food budget, but also help in breastfeeding and nutrition knowledge and planning. And the WIC van pulls in to our early childhood center parking lot just when parents are picking up at night or in the morning when they're dropping off, depending on when their availability. We make an appointment right on site. They don't have to go anywhere else. For us, it's a major reduction of the barrier of transportation. We have parents without cars or with so many children that they can't get them all onto 3 different buses to get to WIC. Or it also means that the whole access in terms of being DEI sensitive is really, really improved for everyone who's eligible. And you will find 100% of people in Head Start automatically, because we have the same eligibility guidelines, are WIC eligible. Think of the increase of people who have food insecurity that can now easily access money and solutions and knowledge. That in itself is just monumentally important. And especially for those of us who have huge numbers of challenged, I would say also diverse, Indigenous community that are not all signed up for WIC, and they are all eligible if they would just do this. This allows us to enhance outcomes. Okay, I'm gonna go on to the next slide. Do you have anything else on food insecurity, Keith? You want to say?
No, yeah, no,
Okay.
nothing else to add. Thanks, Donna. And
Okay.
so, you know, another tremendous child welfare challenge, and to build off on some of what Donna was just referencing in terms of the partnership opportunities with food insecurity, very similar type of partnering opportunities with physical health and special needs. And of course, you know, those of us in the Head Start, early Head Start world understand full well that we are, part of our mandate is to make sure that every child in our care is completely up to date on wellness visits, on vaccinations, inoculations, and dental care. Vision and hearing screenings are commonplace with all of our kids. And then any kind of specialized services that children need as a result of that testing that we do, as well as what's coming back in information from families, from the child's general physician, pediatrician. We're putting all of those things into play while the children are in care with us throughout the year. And we also, you know, again, back to the eyes on the child, our teachers and staff are essentially doing a daily assessment of how kids are doing from the moment they reach our doors till they leave in the hands of their caregivers and parents. So again, just in terms of partnerships, just like with WIC and with SNAP, and the opportunities and crossover in eligibility that we have almost automatically with our kids and families and Head Start. It's the same thing with CHIP and with Medicaid enrollment. Just about all of our Head Start and early Head Start children are CHIP eligible or Medicaid. as well as some of the other kids in their families that aren't preschool age, and parents for Medicaid. But sometimes there's a lot of hurdles and obstacles in our respective communities with enrollment, and even more so sometimes with renewals that are required, and all the the hoops that families have to jump through and know when to jump through in order to continue with benefiting from those incredible public assistance services. So it's really important that across our child welfare and early learning systems that we're talking to one another, just to make sure that, again, these are basic needs that we're talking about, but if they go unaddressed and things are slipping through the cracks, they have sometimes fatal consequences, but definitely long-term adverse consequences for children and for families. Same thing with prenatal and postnatal services and care. We work in early learning with expecting parents. In a future slide, and how we do that work while parents are expecting. And we also have, like I referenced earlier, specialized therapists for identified special needs that are on our Head Start and early Head Start sites throughout each and every week for however many sessions each of our children need with those specialists. And I know a lot of times in the child welfare side of our work, those are requirements, that parents need to adhere to in terms of the identified special needs of their kids and making sure they're getting the care that they need. And so we have a lot of the answers to those problem solving and solutions that are needed on the child welfare side and vice versa. So if you go to the next slide, please, and I'm going to hand it back to Donna to talk about pregnancy education and supports.
Okay, this has now become so nationally focused on that it's very important for us to understand. We have been serving pregnant moms for a while, but nothing like the new focus and concentration across this nation, being driven by the fact that especially Black and brown mothers have disproportionately been dying in childbirth, have very low or early, the birth weight, the birth is actually premature with unnecessary special needs that now are there for a lifetime. We just have to improve these outcomes for everyone, So the strong partnership child welfare brings is that we have been doing this for years in many of our agencies. We have the enhanced relationships with special major medical hospitals in the area or prenatal clinics in the area. We can bring these resources together seamlessly for the pregnant moms now being identified as part of the early Head Start programs by your contract requirements. We are able very much to on site bring in or at the appropriate site bring in a strength of resources. Just having a medical home from the day you find out you're pregnant. My agency tests for pregnancy. The day we find out a young mom is pregnant and we're talking about early Head Start as a piece of what we can offer, that includes our strong hospital health clinic. So there's no day they're not under intensive, good health care all during the pregnancy. We are getting remarkable results because of this partnership with, I'll just give you two statistics that are interesting. One is 100% over the last few years, we've been combining this strength. Those mommies are having full birth weight babies. 98% are full term, not premature babies. 67% exclusively are getting human breast milk in the first 6 weeks of their life, compared to 46% nationally. These are important outcomes because without the health benefits of our collaboration, obviously, we are not turning out anything like that across the nation. Having said that, I think the most important things that you need to know is there is new work among major foundations, Robert Wood Johnson Foundation, Burke Foundation, joining with states and counties, making money available for the enhanced actual professional trained services to be able to collaborate with Head Start pregnant mothers. And that is really critical. So I think I'm going to stop here on this particular and go to the next slide. Next slide, please.
Yep, that's it.
And this, I'm sorry, it's up. The mental health ties into it. This is also new funding. It's coming with federal impetus, but again, being picked up by major foundations. And you should be looking for this, but it enhances what you already have a need for. These are babies and toddlers, some of whom have behaviors that we can't be sure what we're seeing. We know it's not normal for their age, but we need further help in diagnostically understanding them. And then how does one take care of them? And that's as true for mommies as it is for teachers and caretakers for the youngest of our babies and toddlers. This funding now comes into our centers with what's called, and I know some of you may have met a mental health specialist. That's not what this is. The nation is funding infant, toddler, credentialed, clinically trained counseling persons onto your sites to work in real time with your teachers and caregivers, with your moms. And I think this can do so much for early intervention, which is possible. Let's say it's unclear, we might be dealing with the beginning of an infant toddler on the autism spectrum, or we have a severely depressed, listless baby. We're not sure why, what's producing it, what's going on. These are opportunities with early intervention to have much better outcomes. So I think we need to look at this, connect these resources together, and then get some remarkable outcomes from working together on this. These are not easy parts of I'm going to say, starting with diagnosis and understanding, and then for the hands-on staff in Head Start, what do we do? How do we care for these babies? How do we care for these toddlers? This is a new level of professional consultation and hands-on on our center sites help that we've never before. This for us, even in New Jersey, is very, very new. So with that, I'm going to turn it back to Keith.
And just to add to what you're saying, Donna, in terms of mental and behavioral health, I mean, we are definitely here too in New Orleans and throughout Louisiana across our sector are seeing behaviors that are challenging way earlier than we've ever seen them before post-pandemic. And lots of just the enhanced stressors that have been adversely impacting families are adversely impacting their kids, obviously. And even newborns are that don't have any other diagnosed disorders or any medical things are still coming with, stress is like in our DNA, right? So like if, our parents are experiencing stress during pregnancy, our moms, and then through birth, that can come out the other side and continue with infants and toddlers. And we're seeing just things that we really haven't encountered in a long time here in our area. So I know from talking with folks around the country in early learning and in child welfare, it's very similar. So if we can go to the last slide, which is workforce development and financial stability. This is, the last particular child welfare and family challenge that we're going to be addressing today. And that, it's a perennial, it's a constant challenge that we have across both of our systems. with our families. Many times our families who are economically challenged, severely economically challenged in a lot of cases, and undereducated, or, you know, just not very much formal education at all, and not trained, certified in specialty areas. So really with the real lack of ability to get access and opportunity in the workplace, and develop, you know, careers that are really not just going nowhere, but really headed towards success for themselves and their families. And so, you know, just on the Head Start and early Head Start side of the equation, our family advocates across Head Starts and early Head Starts really focus on helping not just the child in isolation, but the child in the context of their family, and of course the family in the context of their community. So really working across systems all the time. And one of the important places where our family advocates spend a lot of time with parents and caregivers and other adults in the household of each of our kids is around job training and certifications, continuing education that they're interested in, and really helping to get them on a pathway to really good paying jobs with great benefits in major industries that have those kind of built-in career pathways that we all want to be part of, right? And certainly our families in Head Start and in early Head Start and child welfare want to be part of that too. Just on a more kind of narrower level, we do have child development associate training for any of our parents and caregivers that are looking at potential careers in early learning, or with Head Start and early Head Start in particular. And we've had so many great experiences with interested parents and caregivers that we've put through the child development associate training. They've gotten certified with the CDA. And then some, it's been as much as 25, 30 years that they've been teachers in our Head Start and early Head Starts, and gone through associate's degrees, bachelor's, master's in early learning following that. So there are great career opportunities in early learning too. And then entrepreneurship is another area of focus that we've been increasing year by year, because we have a lot of parents and caregivers who are doing things out of their home to make money that are, you know, like hair cutting, stylists, makeup artists, and so tailoring, and, you know, you name it, in communities, selling, you know, cooking stuff. And we have a apple pie woman down the street from my agency who sells apple pies out of her apartment, and they're amazing. And it's, you know, but there's, you know, there's a lot of requirements for doing those kinds of businesses first and foremost. So helping our families be aware of what those are, and then helping them, you know, acquire a real business plan, form a real business plan for launching their own businesses. And then, you know, just again, coinciding with what we've talked about with other forms of public assistance, certainly TANF is critically important for eligible families in terms of a source of financial stability. The VITA program is amazing in helping families that not only do complete their tax returns on time, every year for working families, but get every single benefit and tax credit that they're eligible for. Our VITA specialists across the country are phenomenal at helping families. The individual development accounts, you know, for helping families get a car, start a business. You know, it's tremendously beneficial, as well as other forms of tuition assistance and workforce development assistance programs. Donna had referenced a 12-week workshop on how to start a small business that y'all are doing. You want to tell us a little bit about that, Donna?
I do. We bring in child welfare tremendous amount of volunteer, credible volunteer manpower. We're getting this help from our volunteer manpower because we're finding our parents are asking for or have, as Keith mentioned so appropriately, an interest or even have begun to try to start a small business. Not easy to do, but the real technical things you need to know to be successful are what we're offering through the use of volunteers, running a course for them, which has become so popular. These are all for Head Start parents, and we run it at a time they can take the course because they're all using daytime working jobs and they can't just leave their job. That's their income for the family. So we work around their available time, but it's been remarkable, they say, to them in helping them stabilize or actually begin those small businesses. That's one. Now I'm going to tell you about another business. Those major foundations who want to see the better maternal child health outcomes, they are funding a career for doulas. I'm assuming most of you understand the doulas with our mommies, be they with an intact family or a partner, or whether a lot of our mommies are single parents when they're pregnant. Doula as a career, I'm focusing on the career of being a doula. We have huge numbers of Head Start mothers who get trained on foundation funding that's now being going to scale nationally. So you want to look into this because they see it as a viable career with enough steady income that it is worth taking the courses and being trained and credentialed. So I'm just giving you a heads up on that. That's coming, look for it. But I am seeing how many of the moms in our Head Start program wanting that as a career choice. So these are all new opportunities. Working together, we can link this for our Head Start parents. And that's it.
Thanks.
Great.
Thanks, Donna. And so, yeah, we're gonna go to questions now, or
No, we have an activity. We want to hear from our
oh,
people.
yeah. Yep.
We
you're
want to
right.
hear from our
Thank you.
people. So those were some awesome ideas. We know that probably you've got your wheels turning. I saw some questions in the chat. One of the questions was, could we get that slide deck out to folks? And I will just say, we'll figure it out because I know that it had a lot of really good information. We're going to just play a little game here. We're going to use something called Menti. If you haven't used it before, all you want to do is either on your phone or on another tab on your computer, go to menti.com. And then you're just going to put the code, which is 6801. And I'm going to put this in the chat so you have it. All right. 6801-4988. And it'll bring our little game up. And this is going to give us a chance to hear your ideas, a big group, about 125 people. And instead of unmuting and talking over each other, this will give us an idea to gather everybody's ideas into one space. And then we can start to cultivate them and create a resource. It's menti.com. And once you open it, it'll just ask you for a code. You can copy and paste that code I put in the chat, 680-14988. Yeah, I'll make sure I did that right. Yeah. And then you can start answering. So our first question, we thought we'd aim toward our early Head Start folks in the audience. And we're looking for, I think that the question's not up there, Courtney. I don't know if it's just not posting, but what we're looking for is the great ideas you have already that you are using to partner with your child welfare agencies in your community. Do you have things that are working in your experience that you want to share with the group? We're looking for the simplest ideas and even the more complex ideas. You have an early childhood education coalition in your community. That's fantastic.
I really like the early learning navigators.
Navigators, yeah,
That's
get some
great.
coordination
Yeah.
going on. Yeah.
Yeah.
And really just keeping everybody in the communication loop. What a simple suggestion, right? Just making sure you're not only communicating in your own space, that you're reaching out and creating those connections. Again, we see communication, constant contact is a really good resource for that. At the state level, making sure you're making those connections and having conversations. I think that's really important, especially for, sharing resources and things like that. Oh, thinking about new spaces. How awesome is that? Who is talking about building a new building and actually creating space? I would love to know who that is. That's fantastic.
So Deb, I really like at the state level, they're aligning all the plans for
Right.
the work so that you're really moving across the systems, which is great. Or attending the community events, that's really a good one as well.
Yeah, and actually it would be good to know if you're using some particular strategies to linking that state work that might help those who are maybe struggling in other states to see that happen. So Paducah's opening the new building. Way to go. Is that Christy in Paducah with the Head Start program? So that's fantastic. I love to see the sharing of space. When you work in the same space, you create more collaboration organically.
Yeah.
One
Even
of the
this one where you're making sure that the social workers understand how to enroll a child in Head
yes,
Start. I mean, at the agency we were doing child welfare, but that's what we were doing, enrolling the children that we were involved with in Head Start because we knew how critical that service was.
yes. I wonder if anybody, this is something that is always front of mind for me. So I'm curious about my early Head Start folks in the audience. Are you connecting to foster care so that there's an easy entree for easy connection, I guess, between those offices and early Head Start? There's so much good data around integrating kiddos back with their families when they go into early Head Start, if they are in foster care, and being able to work with the birth family and the foster family together. I always think that's a very successful. It's not as pervasive as I'd love to see it, but where they do it, it's really, really
There's a
successful.
new one showing up, Deb,
Yeah.
that you're saying, that they have an informational video. That's really good. That's a good way of doing it.
Excellent. Okay, I'm getting ideas myself here, so I'm gonna have to write
I
this
know,
down.
I'm hoping we're keeping these, Deb, so
Yeah.
that we can
Yeah.
share them back with all of you, so you have these great ideas.
Yeah, this is all going to be saved, and we'll put together, yes, we will make the mentee, we'll put together a toolkit for you from this, make it really easy. So why
Yeah.
don't we go to the next question, which is the opposite. I don't know if this worked or not, if we had our early Head Start folks answer that one. Now I want to focus on our child welfare folks that are in the audience and ask you the same thing. What have you initiated with your early Head Start that has worked in your community? And some of them might be the same answers we just saw. If so, that's fine, but we're just kind of making sure that we're hearing from both audiences. We do know there are unique differences.
I'm looking forward to seeing what the answers are to this.
Yeah, I love that Head Start video too.
Yeah.
Someone put that they love that idea. What I thought about with that is I do all the professional development here at NHSA, and I wonder if we could make a little module on how to connect. That's something we could maybe build and then make
we can talk
available.
about that, but building relationships, we'll look at the two of them that are up. It's so critical. You do
Yep.
relationships. It's the kind of work that we do. It's what happens in our field. So this is
Yeah, that warm handoff referral is so important. And that trust, like building the trust between the two organizations is super important. And it takes time.
It does take time.
And again, we're seeing the navigator. So that must be a thing. I love it. And the training, this is really good. One of the things that I talk a lot about coordinating between Head Start and schools, and it's not that different in this space, in that if you could do shared professional development, there is a lot of crossover in the way we train. And when you learn alongside other colleagues, it just creates a natural relationship. It makes it so much easier to then get together around other things. So shared professional development is a great idea.
Yeah, and then attending cross collaboration meeting kind of thing, really hosting different events where you're getting your counterparts to the events is another great one.
Yeah, getting that Head Start collaboration office involved. Great
Yeah.
idea. And I know sometimes that's tough. Sometimes they sit in Department of Education. So it depends on where they are, but I don't think it matters in terms of being able to still outreach and create connections. I think that you'll still find some good opportunities there.
But looking at the response, Deb, I guess the other thing it raises for me is maybe this is an area where we could spend a little bit more helping child welfare in terms of the things that they could be doing and connecting more with the Head Start, because this service is so critical to the population. So
Absolutely. And so many intersecting spaces there. So if we go to the next question, we're going to flip back to our early Head Start folks. And what barriers have you experienced? So as you've tried to create connectivity, I saw a couple already noted in the other slides. So you can repeat those if you want to. But if you can think about the barriers and why they exist so that we can really dig deeply into this, that'll really be helpful. I know I visited a center in North Carolina when I was the director of the Office of Head Start, and they had been working to get a WIC office in their Head Start program, and it took them 2 years to do that. It seemed like a very long time to do something that was just really a room with a phone in it that someone could sit during the week, but a lot of logistics. Turnover, yeah, because relationship building has to start over when turnover is high.
it's
Language barriers, certainly cultural differences, understanding that's right. Yes, the difference between the associations and the collab office. And I'll just tell you, we have the same issue with NHSA and OHS. So that's just an education thing. You're exactly right.
Hey, Crystal, that's a really good point
Yeah.
about office hours. I think it's an important piece. It really does make a difference, though.
And the time barrier is super interesting because ironically, if we figured out really good collab opportunities, we'd probably save ourselves time ultimately, but it does take more work up front. So I understand that. And we're also busy, short-staffed time. Mistrust is, I think, a really big one. That comes, obviously, the relationship building will break that down, but there is, there's history with a lot of these organizations, and, there are places where trust doesn't exist and it has to be rebuilt.
Yeah, the language one is coming up again, and I love what you're saying in terms of the child welfare jargon. Oh my goodness, I mean, I'm in the field, and you are so right about that. And but it's true, even Head Start has its own, and then where the family fits in the middle of all of that. So
yeah, that's right.
good point. Yeah.
Data sharing.
Can we speak, Keith or I, with a comment?
Sure.
Most child welfare agencies today have very bilingual own staff and partnering staff with strong partners in the community, because culture and language are a very important consideration if you're doing the serving. So I think that could turn out to be an enhancement services for the Head Start families and children.
That's a good point. Maybe there are ways to share those resources and it benefit everybody. I don't know what long time frames for service delivery means. If you're I don't know if that means there's a wait time. I don't know, but that's an interesting barrier.
Yeah, whoever put that in, if you would even put it in the chat, either way, it would help
just
us
to clarify. And then that parent trust is a big one for sure, because there are families who have, had experiences that maybe weren't as positive, and so there's that lack of trust. And having worked in school systems before, I dealt with a lot of that, but we have to figure out a way to make sure we're framing child welfare as a positive resource. It is, not supposed to be, it's supposed to be a positive resource for families and children.
Dr. B, your point is so important. I'm going to say those of us in child welfare today have developed many prevention services. And so we shouldn't just be identified with after the county or the state opens a protective service case. We should be seen as a resource to prevent a wonderful family from ever needing to be an open case. So what we would do in collaboration, we have many primary prevention services that should be shared with our Head Start families. Why wait till after they're identified as being in that much risk and trouble? And that's what's not understood about today's child welfare agency.
So that's a lot of education. I mean, that's education. Let's go to the next slide. And Erin was right. We're going to ask from the welfare point of view, what are the barriers you've seen with trying to partner with Head Start? Where do you run into barriers if you've tried to do some outreach? And some of it might be related to what we were just talking about, which is a misunderstanding of primary prevention. But what other things do you see? This Erin had put in here that the child welfare families need services as soon as possible, and they are often put on waiting lists. Isn't that a great national point to raise when we don't have enough Head Start and early Head Start slots? And of course, we've seen huge issues with staffing, which has impacted our ability to often open classrooms. So it is a really tough time. Erin is absolutely correct. Yeah, we can't hold, although, well, I don't know, we hold slots, for homeless children experiencing homelessness, but yeah, it is, that policy is it's tough because we don't want the slots to sit empty, but we understand that the needs can be very urgent.
What is that single data source for the numerous sites? You have to fill out information each time for each site. Is that what that's highlighting? Oh, I love the limited hours, especially when families work. And that is so true. Yeah, you need the non-traditional hours. So whoever put the single data source, it would be really helpful if you could clarify for us, even if you're putting it in the chat. Thanks.
And I love the systems integration comment and wondering, I'd love to hear more about that. What are things beyond holding positions that you think are vital to systems integration?
Oh, I love what Chevelle is clarifying in terms of wanting an agreement to have one single
right.
data source. I like that. Yeah.
I wonder, well, yeah, probably that needs to filter from the state level, but I wonder if there's some way for us to do that at the state level, like come up with these sort of MOUs that could be used across a state. Probably can't do it nationally, but statewide you might be able to.
Yeah, especially when you consider, I mean, it is a burden on both systems to collect the information, but it's also a burden for families to have to be giving the information.
Right.
Again.
And our friend who put the difficulty with eligibility, we feel your pain. But I would also say last year we had this really incredible shift to SNAP eligibility for Head Start and early Head Start. So if one of your families is SNAP eligible, they are eligible for Head Start, case closed. So that made verification so much easier because they've already got the paperwork. So just keep that in mind. That may not be common knowledge in the child welfare space. So might be a good thing for us to lift up.
Deb,
so that
did
folks
you
know.
Notice Monica's comment that in Iowa, they have an integrated data system between the different systems? I love that.
Oh, well, maybe we need to have Iowa come speak to us at one of our webinars.
Yeah,
that would be really interesting, and invite our collabs and state administrators to come here. How are they doing it? I mean, that's the kind of thing we can share out.
Yeah, Julissa, where are you from? So we can know that you might also be able to share information related to what you're talking about. Your vision.
We're in California. California.
Excellent. And we'll have all of your email addresses so we can reach back out to Chevelle, for example, and to Julissa to bring them in. Excellent. Excellent. The limited hours is a really good one. And it's a challenge even for Head Start too.
So Deb, this is a good question. Somebody's asking, what about the ability to partner further upstream, right? Before the child is removed, so that we're really, being more respectful in the way in which we're serving families.
Right. I think that's really what Donna was talking about, right? Is seeing child welfare as a prevention, not just a reactive organization, and taking advantage of that shift. Because I know when I was at OHS, Jerry Milner was all about primary prevention. And that was the whole conversation, was get upstream, exactly that conversation. What I would love to know, what policy is preventing that, to know more about what are the policies that are preventing that. And is that a space where we, as we work together on advocacy, we think about some of those policies? I think sometimes it's where it's not policy, sometimes it's just our practice prevents it, because we wait for a kiddo to enter foster care instead of getting involved earlier and creating those connections.
Yeah. And I think the other thing, Deb, of course, is Family First requires the money to go only for certain kinds of services.
Yes.
And it does not include the Head Start or, those kinds of services. But, it's an evidence-based program, so it is possible.
Absolutely.
Only in parenting type of courses, mental health, services, mental health, substance use, there's
100%. And Jillian's comment over here, that having lived in both spaces and seeing that global sort of opportunity, like Jillian, we need to connect with you. I think learning from you all is the best thing we can do, and then lift up those ideas. And this idea about capturing data on outcomes, I think one of the strongest data points is with early Head Starts, connectivity with foster care and supporting children returning back to their families. I mean, we see this pretty strongly in the data, and I think that's why why I talk about foster care and early Head Start so much, because I'd love to see more of a fluid referral system that makes it easier for child welfare agencies to easily connect families to early Head Start at some level. But I know that the previous comments about having waiting lists, I get that too. Excellent. I will, Jillian. Okay, we have one more quick question. And you all have kind of already answered this because we've had these conversations and it's in the chat, but for all of you, we've got 2 national organizations that have worked to come together and commit to finding areas where we can support greater collaboration. That could be through advocacy, through professional development, whatever. So if you want to throw ideas in the Menti on, hey, could you do this? Could you support X? This is your opportunity to do it. And we'll take these ideas back to our next meeting. Yes. Streamline the application process. I see that in the chat. So we'll save that even if it doesn't make it into Menti. But if you all have ideas for ways that at the national level we can support you, we have some opportunities to do things in a nice, broad, loud way. There are ways that you all are going to be better at this than we are because you're on the ground. But if you see opportunities at the national level, throw those out there into the Menti and we'll save them.
And the other thing, Deb, I just put my email in the chat.
Yeah.
You're welcome to send ideas. You know, after this, you might have things floating around saying, oh, I wish I had a said. You're welcome to send your ideas through to me, Deb, you know, I'm sure you as a.
Oh,
your
yeah.
membership
Yeah, all of
can
us are
review.
here. I'll put my email here too. And Monica couldn't put her idea in, but yes, I love this. And I do think just idea sharing has a huge impact. And a collaborative agreement, we have one. It was signed today. So
So
we're
are you asking for something else across that
Mm.
would be a different kind of national agreement? Let us know if there's something else that you want in that.
Yeah, I wonder if it would be helpful if we could pull together MOUs or templates or something to help get people started if they don't have anything formalized. Sometimes it helps to get a little jump start.
Yeah,
Yeah, we signed the MOU today, so we're going to get it out onto our websites and we'll share them with you.
but a template for states to
Yeah,
use
yeah.
themselves, I think that would be really good. I
Some
like the idea.
summits. Yeah, what a great
summits,
idea. Yeah,
Yes, we can
Sure.
think about these. These are
yeah,
great ideas, everybody.
excellent. Yeah, extended day programs are really important in Head Start for sure. And I think the way that typically programs are able to do that is by partnering with childcare and then figuring out the funding solution there. So that is and that may be a topic of conversation if we start talking about national advocacy toward policy and things like that we want to talk about. Oh, nice. I like that. Some national data that people can use when writing grants to some of those organizations that Donna was talking about. That could be really helpful.
Yeah,
Yeah, I'm telling you, Sonia, lots of people don't know about the new there are Head Start people who are still learning this. It is such a big deal though. And the primary, what's interesting about it is its real purpose is to help make eligibility more administratively or less administratively burdensome for families, but it
Yeah.
also opens up eligibility a little bit, but it's just so much easier. So yeah, lots of conversations and we'll make sure that we are using our networks to get that out. We are at time. So I am going to go ahead and close this up, but I want to thank everybody on this webinar. We're so excited here at NHSA, and I know CWLA feels the same way. We started this conversation, and you know, sometimes you can just talk about collaboration and you think it feels good and you don't do anything, but this has been pure action. And so thank you for joining us at our kickoff event. Really, this is it. And the MOU is official. So look for more excitement coming your way and keep in touch with us. Share your great ideas. Our purpose is to really bring together your awesome work and create sort of these resources that we can share nationwide. So thank you so much, everybody. Have a wonderful afternoon.
take care.
Thanks, y'all.
Thank you.
Bye.